We are here at the 2011 ONS conference in Boston, Massachusetts, joined by one of the finer Jayhawks from Kansas, and that is Dr. Jamie Myers. Thanks for being with us.
My pleasure.
Let's first begin with your abstract, and it is titled Chemotherapy-Related Cognitive Impairment, the Breast Cancer Experience. What can you tell us about this work?
It was work I really enjoyed conducting. The side effect of chemotherapy-related cognitive impairment by the lay public is referred to as chemo brain, which I think I'll use today because it's easier to say. But it's been seen very commonly in a variety of different types of survivors of cancer, and breast cancer survivors have been particularly verbal about it. And some of the research has shown that up to 83% of women with breast cancer experience cognitive changes at some point during their treatment. So I felt that was an important thing to look at, and when I explored the literature, what I found was there wasn't really a description of the experience that the women had, nor could I find concrete information about what women would have liked to have been told prior to receiving their therapy or when they started to experience changes. So those were the questions I sort of set out to answer. What's an in-depth description of the experience, and what information should we be providing to women up front?
What led you to ask those questions?
By reviewing the literature primarily and noticing that there was a gap there, which is kind of what we all look for as researchers, something where you could add to the body of knowledge. We are still learning about this side effect. We don't yet know exactly what causes it or how long it lasts, but one kind of concrete step I felt I could take personally was to describe the experience and maybe get some specific information we could provide to nurses to educate.
How did you conduct the study, and what exactly did you find?
Sure. For a qualitative study, you are allowed to not have as large a sample, which makes it more finite and easier to conduct in some ways. So I purposefully went looking for adult women with a history of breast cancer who had completed chemotherapy within, say, the last 6 to 12 months. And so I purposefully sampled those people as opposed to doing a randomized trial like you would do for a quantitative study. And then I conducted an in-depth interview with them, not unlike what you and I are doing, where I audio taped it and then transcribed it verbatim and used a qualitative content analysis to analyze the data, and then came up with study themes in which I could use as a framework to present the results.
So what did you find?
I got some very poignant descriptions from women, obviously, very rich information, but to try to synopsize it a bit, women almost, well, I will say 100% of the women still had issues with word finding. They had issues with short-term memory, and they had issues with some performance. There were 2 women in the study that felt like they had lost employment as a result of the cognitive changes that they experienced. So that was pretty powerful. The other thing I noticed was that women analogized the experience to what it felt like to them. And at least 3 of the women told me it felt like that when they were pregnant and sharing their brain with the fetus. And a term I had never heard of before was placenta brain, because I'm not a mother, I haven't had children. But I guess it's a similar experience to being fuzzy-minded and not being able to be clear-thinking and remember some of the things that you would like to remember. Women spent quite a bit of time telling me how they coped with the experience, which included things like writing things down. And I think 100% of the women used that as a strategy, whether it be a day planner or a Palm Pilot or a cell phone. They wrote things down that they needed to remember. They depended on family to give them cues for things that they knew that they were going to have difficulty with. There were a number of women that wanted to do something to give back. So some women wanted to volunteer in infusion centers to help other women who were going to start chemotherapy. One young woman wanted to start a support group for younger aged women because some of their issues are different with breast cancer than the older women who would be diagnosed. Exercise was a strategy that particularly intrigued me because there's some interesting research that says that exercise may mitigate the effects of fatigue that we see with both cancer and cancer treatment. And so something I'd like to study in the future is how exercise might mitigate these cognitive changes that women experience.
Doctor, how are your findings applicable to clinical practice?
Well, the piece that I hadn't quite shared yet was how they wanted to be educated. They gave me some very specific information about how they would like the information delivered and how much information that they wanted delivered. And the thing that surprised me was it didn't really matter who on the healthcare team provided that information, as long as it could be an individualized approach. So in other words, find out how they wanted to learn and deliver the information in that way. They adamantly felt like someone should tell them about this before they started therapy, and actually only about 1/3 of the women had that experience. So what I say for clinical practice is we definitely need to educate about it up front. It'd be a part of the informed consent process, and if we can, we need to individualize our approach. The other thing they mentioned that we may not be able to provide is they really wish that the person that taught them was a survivor themselves, because they would truly understand the experience.
Seems like pretty interesting work. You sought out to answer certain questions, and it sounds like you discovered many more worthy questions to ask.
Absolutely. So it gives us more room to do the next step in research.
Doctor, thanks for spending some time with us and telling us about your work.
Thank you, Thomas. I appreciate the opportunity.
You got it. Dr. Jamie Myers from the University of Kansas School of Nursing, joining us on Oncology.TV at the 2011 ONS conference.